Most people think that osteoporosis is just about aging, but if you have hypothyroidism, hyperthyroidism, or autoimmune Hashimotos or Graves' disease, your bones could be at risk. Let's talk about that. Hi, I'm Dr. Keisha Ewers, and I help people reverse autoimmune disease by getting at root causes and healing from the inside out. If you're one of these people with Hashimoto's, Graves', other autoimmune diseases, thyroid problems, and you're wanting to protect your bones, you can click the Linktree link underneath my profile name. And there's some resources there where we can get started in reversing the process that may already be in place. So let's talk about why the thyroid is so connected to bone health. So there are 4 ways that the thyroid is intimately connected to your bone matrix and density. Thyroid hormone affects it in 2 of those ways. Too little thyroid hormone, and you have a very high risk of having weakened bones. Too much thyroid hormone, and you have a high risk of actually having weak bones and osteoporosis. So this is one of the places where my patients, they a lot of times like to run themselves with their medication into a hyperthyroid state because they have more energy. But actually you're putting yourself at risk for osteoporosis. So it's not a good idea. We want to have that Goldilocks place just right, not too much, not too little. The other thing is that any of those are autoimmune in nature and therefore inflammatory, and inflammation also triggers bone loss, i.e. osteoporosis risk. And then lastly, your thyroid, when it's malfunctioning, makes it so it's difficult to absorb the nutrients necessary for bone density, calcium, magnesium, and vitamin K. So if you'd like a full thyroid panel, if you want to know how to track that thyroid, if you want to reverse autoimmunity, click that Linktree link and let's get you started.